Hello and welcome to GP Notebook TV. My name is Anish Katecha and I'm a GP in South Wales. Today I'm discussing the recent MHRA drug safety update from April 2025 on short-acting beta-2 agonists or SABAs in asthma management. So let me give you a little bit of background here and some context for primary care. Asthma reliever medications like salbutamol and terbutaline are prescription-only SABA medications used to treat breathing problems in people with asthma and similar conditions. Previously, these were recommended as required for symptomatic relief, and for some patients with infrequent symptoms, SABAs alone were considered potentially sufficient. However, significant evidence has emerged showing serious risks associated with SABA overuse, leading to important changes in prescribing guidance. So in 2022, the MHRA and EU's Pharmacovigilance Risk Assessment Committee reviewed data from nearly 188,000 UK primary care records of asthma patients. They found a concerning association across all asthma severities that having 3 or more SABA prescriptions in 1 year was linked to increased severe asthma exacerbations, independent of whether patients used maintenance therapy. Even more alarming was evidence from the UK National Child Mortality Database. Of 54 child deaths due to asthma between 2019 and 2023, 87% had excessive reliever inhalers dispensed in the year before death, while 65% had insufficient preventer inhalers. Now, the evidence consistently showed that clinical outcomes were poorest when using SABAs alone. SABA overuse increased risks of severe exacerbations, hospitalizations, and mortality. These risks existed regardless of asthma severity or anti-inflammatory therapy use. And these findings prompted significant updates to the UK asthma guidelines in November 2024. Now, the new recommendation is clear and represents a fundamental shift to not prescribe SABAs to people of any age with asthma without another prescription of an inhaled corticosteroid. Now, for our daily practice, the MHRA advises never prescribe SABAs without also prescribing an inhaled corticosteroid. Ensure all asthma patients receive optimal anti-inflammatory maintenance therapy even when well controlled. Review and adjust treatment for patients using SABAs more than twice weekly. Urgently review patients requesting increased SABA prescriptions or failing to collect preventers. And consider anti-inflammatory reliever therapy or maintenance and reliever therapy or MART as alternatives for people over 12 with poorly controlled asthma. Now, the new guidance emphasizes that most asthma patients should be controlled on either anti-inflammatory reliever or MART treatment without needing SABAs. Now, to implement these guidelines effectively, review your asthma register to identify at-risk patients, those frequently requesting SABAs, those not collecting preventers, those using SABAs more than twice weekly. Update asthma action plans with patients to reflect the new guidance. Ensure your systems can flag SABA overuse as well as preventer underuse. Now, when discussing this with our patients, we should explain that blue inhalers or reliever inhalers should always be accompanied by preventer therapy. We should emphasize using preventers as prescribed, even when symptoms are well controlled. We should advise seeking review if relievers are needed more than twice weekly. We should be discussing anti-inflammatory reliever or MART alternatives for appropriate patients. Now, in summary, the evidence is clear. SABA overuse increases risks of severe exacerbations as well as mortality. The updated guidelines recommend against prescribing SABAs without an inhaled corticosteroid for anyone with asthma. As primary care professionals, our role in implementing these guidelines is absolutely crucial. Review asthma patients regularly with personalized action plans, and that remains absolutely essential. particularly focusing on patients overusing relievers or underusing preventers. These changes represent an important shift in asthma management that could significantly improve outcomes and save lives. Thank you for watching this GP Notebook TV update, and stay tuned for more videos on the latest developments in primary care. Goodbye for now.